Hello and welcome to the Consistency Project Podcast. Every week here on the show, EC and I aim to simplify the science of nutrition, health, and fitness, cutting through the noise to focus on the principles and practices that will help you perform better, feel better, and of course, live better. My name is Patrick Cummings. I'm here with just a quick introduction to the episode. We've got today a conversation EC had recently with Dr. Joey Zundell, a cancer researcher who brings clarity to this complex topic. Here's what you can expect this episode. They're going to explore the current state of cancer treatment and why the war on cancer isn't as dire as social media might have you believe. Dr. Zundell breaks down why dietary interventions for cancer need careful consideration and clinical supervision. They discuss how basic lifestyle factors like exercise, sleep, and maintaining a healthy weight play a crucial role in cancer prevention, and of course, much, much more. Without any further ado, let's jump into the conversation with EC and Dr. Joey Zundell.
Thrilled to have you on here. And one of the things that I've seen a lot in the influencer sort of online expert space is people will sort of be a little bit down on the war on cancer. And they'll even make these claims that we've failed the war on cancer, that we've been doing this for decades and decades with tons of research and tons of money, and it doesn't seem to be getting any better. And things are, if only, are getting worse according to the headlines. And so I'd love it from your perspective as a cancer biologist to put some context around that for us. Is it really getting any worse, better? What is the status of the war on cancer?
That's a phenomenal question. And I think that social media would have people believe that the world is a complete shit show. And excuse my language, but it's who I am. So it's significantly better than even it used to be 10 years ago regarding advancements, not only in a therapeutic realm, but also from an understanding of cancer biology and how the disease varies amongst different cancer types. So, like I said, it's very easy to get wrapped up in this bubble of negativity because that's what spreads clicks and fear and all this crap on social media. And I find in my own page that very few people, so shockingly I have a following, but very few people come to social media to actually have kind of that necessary discussion and contextual discussion about what we know and what we do not know, and how that ties into the bullshit that other people push on social media regarding their own, excuse my language again, but their idiotic agendas.
Yeah.
That I try and correct as humbly and as honestly as possible.
Yeah, and I mean, I think what's confusing for people is not understanding kind of the complexity of cancer. And so you already mentioned that there's been some improvements in terms of some therapeutics. There's probably been some improvements as well as diagnostics, which is why maybe we're seeing some of these statistics go up. But can you give our audience some better understanding about why cancer is so difficult to treat? I think, Nixon had made this statement that cancer would be, cured in 5 years or something like that. Why has it taken so long, and why are we still looking for so many therapies?
Yeah. So for me, this is the hardest thing to convey to people, that even if somebody is diagnosed with the same type of cancer amongst different patients, different people, even though it's the same cancer, will have very different responses to the same exact treatment. And it's because the human body, even cancer cells, are more than just the few things that we are capable of identifying in any given study, in any given clinical trial, than those few mechanisms of action that we determine to be a target of a specific therapy. So actually, I just did a post on this recently utilizing non-small cell lung cancer as a component to try and educate others on this. And basically, there was a clinical trial utilizing Rybrevant, which is an immunotherapy basically, alongside pemetrexed and carboplatin in a clinical trial compared to a group that just had the chemotherapy. And even amongst these cancer patients in this trial, it was a good 300 and so plus people randomized in different groups. Even people in the same group that got the same treatment responded wildly differently despite having the same cancer. And it's because no matter how many mechanisms we identify in a specific cancer, like non-small cell lung cancer or NSCLC, there are still a million things going in the background that can dictate a person's responsiveness to therapy, that realistically we can't see all of that stuff going into developing that therapy. But the point of that stuff is that it performs better than the gold standard, which would just be the chemotherapy alone. So in that case, you see like a 35% response rate with the chemotherapy alone, but that 35% response goes up to 62% when you add Rybrevant to the equation, that immunotherapy. So that's a dramatic and a huge improvement in terms of not only response rate, but also cure rate. You have one cancer patient where there was no evidence disease of cancer, of non-small cell lung cancer in the chemo group alone. But when you look at the addition of just Rybrevant in those patients, you go from 1 to now 6 patients of no evidence of disease. And that's a massive improvement considering how complex the disease is, despite the fact that it's the same type of cancer between patients. Conveying that level of complexity to people and saying that there are cures out there, we have cured it, but assuming that cancer is a simplistic disease where ivermectin or hydroxychloroquine is the cure-all and it's the government's keeping it from you. Convincing people that that's not the case is a challenge. People just need to understand that biology, life itself, is complicated, and that's for a very good reason. And cancer sometimes hijacks that and screws things up.
Yeah. I mean, I think it's tough. We put it under this umbrella of cancer, but even within one type of cancer, there's going to be this really wide range of treatment, and then treatment success, and then we have tens and tens of types of cancer. So just a huge range of variability. One of the things that I've heard you talk about before that I think would be really useful for my audience, because, I'm a nutritionist, so I take things from a lot of the nutrition angle, and
Sure.
I get a lot of questions, and I know you do as well. People looking at using diets as a therapeutic treatment for cancer, keto, low carb, no sugar, all of that stuff. But I think one of the things I said that I think you do really well is kind of this double-edged sword problem of maybe prescribing something like fasting or keto. Let's just say that there was clinical evidence that they were wildly successful, but what is the problem with taking a dietary intervention like that and just assuming it can be curative?
Yeah, so the pros of implementing dietary strategies are that it can help to promote things within the body that enable a person to respond to treatment. So we are learning in current clinical trials where we're investigating things like fasting approaches under very careful guidance and supervision of clinicians. Fasting approaches and ketogenic diets and those sorts of things can enable certain therapies to work, but the rationale there is applied specifically to that given type of therapy. And I'm not going to go into all the details there, but essentially the diets can enable the therapy to work better than without the diet. It's kind of the same way that we would do clinical trials in comparing the gold standard and then the gold standard plus the thing that we want to see if it can improve, like the chemotherapy, and then the chemotherapy plus the Rybrevant situation that I just spoke about. So diets can be helpful regarding that perspective. That's the pros of that situation. We're still learning a lot about it. So a lot of what I do on social media is to try and temper people's expectations of what they can reasonably expect a diet to do or a dietary intervention to do, and understand that it needs to be under very strict supervision of a clinician, because you can't have, just the same way that you can't have the same treatment across a diverse types of cancers, the diet needs to be considered along the same perspective. You can't have that same diet across, colon cancer patients as you'd apply to a breast cancer patient or an esophageal cancer patient. Every patient's going to have their own individualistic needs. Often it depends on whether or not they've already had treatment, whether it's surgery, an immunotherapy, a chemotherapy, sometimes combinations of those things, and whether or not it will actually enhance or be beneficial to their quality of life. So a lot of people assume that we're, doctors or oncologists or even people like myself are heartless individuals and we don't care about the quality of life of a patient. But that is very, very far from the truth. It's a huge component in terms of determining how a patient is treated. So again, pros, diets are being investigated to enhance therapeutic responses, but we still have a lot to learn. And the cons of this are that if a diet is implemented in a context where we don't understand all of how that diet might be helpful for somebody, a person might be taking a huge risk and it can actually make a cancer worse. So there are some preclinical studies, for example, I don't know the PMIDs off of the top of my head, but there are some preclinical studies and even clinical studies that show that ketogenic diets alone can actually make certain cancers worse. So people need to be very, very conscious of those sorts of situations and understand, again, that cancer is a complex disease and that implementing a diet can be helpful in certain contexts, but we also need to understand when it will not be helpful and when it could potentially make things worse.
Yeah, and I mean, on something like fasting, you're also taking away nutrients from the person and potentially at two extreme levels, right? So you have this duality of trying to fuel their healthy cells while they're trying to combat the cancer. And that's some of the difficulty of this whole situation, right? Like you have this duality that you still need to have the person stay healthy with their healthy cells, but yet the fasting might actually be precluding them from getting all the nutrition they need.
Yeah. So as an example of this, you've probably heard me talk about cachexia in cancer patients. So within about 33%, give or take, of cancer patients exhibit cachexia at least some point during their disease trajectory. Cachexia is essentially muscle wasting that happens sometimes because of a treatment, but also because of what cancer can do to the body in terms of messing up our overall metabolism and often disabling somebody from engaging in healthy behaviors that they might otherwise do if they don't have cancer. Mm-hmm. So muscle wasting is a huge problem. And actually in advanced stages of disease in terms of cancer patients, about 80% of advanced stage cancer patients exhibit this and end up dying from cachexia because their bodies can literally not take anymore. And actually, I experienced this just from my own perspective with my mom, who passed away from esophageal cancer when I was 17. She was an obese woman at some point. And then when she got cancer, she was literally at some point towards the end of her disease, as it was advanced, she was 90 pounds total. That's absurd. So giving advice to somebody like that to fast or undergo this really strict diet that they probably can't even adhere to in the first place is damaging from a therapeutic perspective, but also damaging from the fact that they're literally not getting enough nutrients as it is. Their muscles are wasting due to the disease and the treatments. Mm-hmm. Fasting is the last thing that they want to do. And often doctors will tell their patients if they have severe issues, you need a lot of calories. So they'll tell them to even go to McDonald's, Hypercaloric foods can be a person's best friend. Yeah, they're ultra processed. Yeah, they might not be good for somebody. Yeah, we can shit on them online and say, oh, ultra processed foods are giving everybody cancer. But for somebody who's experiencing cachexia, they're not getting enough calories. That can be the difference between life or death. And so for people to understand those contexts is integral for the understanding of various stages of a cancer's progression.
Yeah, my mentor, when I was doing my licensure for nutrition, she does nutrition for cancer patients, and I enjoyed working with her, and I just know the biggest top takeaway is you have to get them through the treatment, whatever the diet is. That's step one, and then you can start worrying about specific foods. But in some cases, it could be McDonald's just for caloric need. Yeah. I want to pull on that keto thing a little bit. Obviously, keto is a trend that we can't seem to get rid of, although I know that there can be some good uses of it too. But the point that you made, in some cases it can actually make something worse. Is that because of the adaptability of cancer, or is that just that cancer type already preferentially uses fat as metabolism, or both is possible?
Short answer is both. It could be the adaptability of that tumor. So if you deprive, if you go low carb through a ketogenic diet, cancer cells will adapt to that low carbohydrate environment depending on where the cancer is and shift its metabolism to be dependent on another fuel source. It could even be something like glutamic acid, which Dr. Thomas Seyfried has his kick on, which honestly he just needs to shut the fuck up. But there is some benefit to that kind of stuff too in those contexts. And I've even conducted my own research and published papers on the implementation of even inhibiting glutamine metabolism in cancers, because they will shift their metabolism to favor the uptake or production of specific fuel sources to enable their continuous growth. And glutamine is one of those things, whether it comes from protein or if they can synthesize it themselves. Doesn't always matter, but that adaptability is certainly a component.
Yeah, so I think one of the takeaways I want my audience to hear from you is, though, there has to be this really high level of specificity, the cancer type, and even knowing its current metabolism, to then be able to decide if I'm going to use a dietary intervention to aid the therapeutics versus just being like, fasting will do it.
Yeah. And that is done. I mean, we all see the clips of people online talk about not only ketogenic diets, but obviously you mentioned fasting, and also the 7-day water fast bullshit that goes around by this cardiologist who, again, seemingly is talking way outside of his area of expertise. And I think on this point, people need to understand that even as a cancer biologist, I can't possibly know everything about every type of cancer. My training was dedicated to understanding the biological similarities and differences of all the things that can happen between cancers, but that doesn't mean that I'm going to understand, all of the staging and all of the diagnostics and treatments and biology of a glioma versus a pancreatic cancer versus an ovarian cancer versus a lung cancer, and so on and so forth. People need to understand that just because we're doctors and we have specializations in certain fields, if I had training as a cardiologist, I shouldn't be talking about cancer biology confidently. And I think a lot of MDs and a lot of PhDs don't immerse themselves in their educational environment in a way where their ego is tempered. And then they get on social media and they feel confident enough to talk about things which realistically they haven't been trained well enough in, but nobody's ever told them that they aren't qualified enough to talk about the things that they often talk about.
Yeah, it is wild to see like a GP just all of a sudden be the cancer expert.
Yeah.
I guess one more thing kind of on this double-edged sword idea, potentially some of these diet approaches could also be negative for the person's nutrition need. Is that also, I'm assuming, what makes just conventional chemotherapy or immunotherapy difficult to create, because it's the same issue of like you have to target these cells that are part of the person, so you're potentially killing those cells while trying to not kill too many healthy cells.
Yeah, everything is about a balance, or as we scientists like to call it in fancy terms, it's called homeostasis.
Yeah.
So there is no treatment, no matter how targeted it might be, that will be 100% effective for all patients. And that's, again, why we see variability amongst the same treatments in the same patients in clinical trials for the rest of time, and we will continue to see that vary, especially in relation to cure rates. Even amongst something like an immunotherapy, which is kind of as targeted as we can possibly get, there's too much of a good thing too. In activating an immune cell against a cancer cell, you want to temper that response such that you don't get too much of an immune response, because then you basically induce autoimmunity. You have that immune cell subset that you've activated against the cancer suddenly doing a great job at killing the cancer, but it loses the ability to regulate it itself in not attacking normal healthy tissue. And so sometimes even with bispecific antibodies, CAR T-cell therapies, and immunotherapies like Opdivo or durvalumab, these anti-PD-1, PD-L1 immune checkpoint blockade therapies, you see basically like a cytokine storm called a cytokine storm. And it induces a very large amount of bad inflammation at that site that affects the healthy cells at some point more than it does the cancer cells, because those cancer cells are messed up. They'll kind of adapt to it. And so we have to temper that response with those types of therapies.
Yeah. Yeah, kind of circling back to some of the crazy stuff we see on social media about all these doctors praising maybe ivermectin. I know I've seen over the years like high-dose vitamin C as therapeutic. I do think there are enough anecdotes of people who did an alternative treatment and were cured. And so I think that does make it hard for the layperson to kind of understand, okay, here we've got Joe telling us that stuff doesn't work, but certainly there are enough of these stories of somebody turning down conventional medicine treatment and actually living, although it's not what we're recommending here. Can you give us some understanding of what's actually going on in those cases? And why we're going to see some of these people who, let's say, do high-dose vitamin C and, in fact, do become in remission from cancer?
The thing that's tricky about that is it's hard to see whether or not these clinics that these people go to operate upon a strong degree of ethics such that the people that go and see them actually have cancer. And so it's entirely possible that these people go to clinics and they receive a false diagnosis that they have cancer, and then they receive this high-dose something, whatever it's vitamin C, NAD injection, or ivermectin or whatever, and then suddenly this clinician is saying, oh, you came in with cancer, your cancer is gone. That's a possibility. So basically people are being lied to, because a lot of these services, their only incentive is to operate as a business and sell that business model to as many people as possible. And so it's fraudulent. And so their whole business is to report testimonials and positive outcomes. They're not required to report negative outcomes. Right. When I do research in my area, I have to report everything. In a clinical trial, you have to report everything. Negative outcomes, adverse reactions to a treatment. You have to report positive outcomes, but everything needs to be on the table. No matter who funds that study, it could be J&J, it could be Pfizer, it could be Insight, where I've worked before. It could be my current company that has funded the study. We have to report all of those things, conflicts of interest. These companies give people these infusions. They don't have to report jack shit other than positive testimonials.
Yeah.
And so when a cancer patient sees that, they're inclined to think in a very desperate way that, because it's a scary disease, that this vitamin C infusion or this IV glutathione or whatever is going to cure them of their disease, when realistically they're only seeing a positive outcome of something that they didn't even know existed in the first place.
Mm-hmm. Yeah.
So that's my problem with these things, is just that there's too many unknowns that I have very little confidence. And the research that I can look up in relation to something like vitamin C, it's not targeted enough for me to be confident in relation to like a chemotherapeutic. And this isn't me being biased because I study this stuff. This is me understanding the biology of the disease to say that a chemotherapeutic or an immunotherapy or a targeted radiotherapy or even radiation and surgery is going to have way more profound and effective benefits. The pros are going to vastly outweigh the cons with well-studied interventions than something that hasn't been not only well-studied but is not targeted, like vitamin C.
Mm-hmm. Is there also the possibility that the person's own immune system just somehow was able to stop the cancer from spreading? And
maybe, but the thing is, like, I don't know.
Right.
You probably hear people rarely say those three words on social media.
Right. Yeah.
And there's no way of knowing because, again, I can't legally access all the data that these clinics are collecting. All I can see is this testimonial from somebody, and that's not how science is done, truthfully.
Yeah. I mean, we see that even on various nutrition things too, just, various trials with products, but they don't show you the data.
Yeah.
You're like, well, that's going to be a problem for me to recommend that. Okay, so one of the things that I mentioned is that I really love how you bring it back to basics. I mean, you can talk about all these mechanisms, but then at the end of the day, some of the recommendations I've heard you say are things like maintain a healthy weight and exercise. And so I'd love to kind of just maybe try to bridge the gap between understanding why some of these basics can be some of our strongest levers to prevent cancer. And so could you shed some light on how obesity does increase cancer risk? I know on our podcast, talked a little bit about inflammation mechanisms. Mm-hmm. Is it more to do with maybe influencing sex hormone levels?
It's a lot of everything. And I'm not an expert in this area. There's a lot I do not know. But I think people have this misunderstanding that things are simpler than they seem, because fat tissue in an obese person comes in a variety of different shapes, sizes, and functions. So there's white adipose tissue, there's brown adipose tissue, there's Beijing adipose tissue, typically seen in athletes, although we can't confidently confirm whether or not it's a real thing, but it's been seen within certain studies. Each of these different types of adipose tissues have different effects from a hormonal perspective, but also from a metabolic perspective. And it's different than how our muscle cells impact our hormones, but also our metabolism. So if I have too much adiposity, specifically white adiposity viscerally, it's going to negatively compete with the signals that are coming from my muscle tissue to try and maintain, again, that balance in that body, or that homeostasis, to keep things normal. And it can predispose somebody to many different types of cancers, at least 13 at this point. So that's the basics of it from a hormonal perspective and a basic metabolic perspective, because being obese can impact a person's not only physical activity, it's going to make it more challenging for them to move, but it's also going to make it more challenging for them to sleep. And we know that sleep disruption is actually considered a carcinogen at this point. We know that people who are obese, that sleep disruption is directly linked to increased cancer risks. So that's why we've categorized sleep disruption as a carcinogen.
And that's independent of its effect on somebody's interest in exercising, or it's independent of its effect on somebody's appetite, that they might be eating more because of lack of sleep, that the lack of sleep itself. Why would it be a carcinogen?
So that's more so related to circadian disruption. And my wife has actually studied that quite extensively. She did her thesis work on how circadian disruption impacts obesity and things like diabetes.
Sure.
But in relation to cancers, it can, over time, if somebody is chronically not sleeping in accordance to their physiology, in this case, circadian biology, we're diurnal beings. We should sleep during the nighttime and wake up during the day, and our hormones and our bodies adapted to that through evolution over time. And if we go against those natural and normal physiologic responses, it can predispose us for diseases even like diabetes and obesity. And over time, that can increase our chances for cancers.
I sometimes find myself, especially with all the noise on social media, I'm like recommending such obvious things. You're like, well, we should sleep when it's dark out. And I say things like, we need to eat fruits and vegetables.
Yeah, I think social media has predisposed people to look for these biohacks or these quote unquote simplistic things that they can optimize in their lives, when realistically the basics, exercise, good sleep habits, minimizing smoking, alcohol consumption, consuming fiber, eating a nutritious and diverse diet, not consuming too much red meat. Like, people like to exist seemingly in these cults or camps on social media because they want a simplistic answer, but realistically, the basics are not so basic when you look at them mechanistically at their core. Like,
yes.
You look at the benefits of what exercise is actually doing to promote good health over time if someone's consistently exercising to the human body. And it's not only wildly diverse, like the treatment efficacies of cancer therapies, but it's just incredibly complicated. And while those are the basics, they're still ignored for these fads that have less of a likelihood of helping somebody be healthy than exercise, good sleep behaviors, and these, like, if they actually focused on those things, they'd be healthier than going to a supplement company and being like, oh, I'm just going to jack myself up on IV glutathione and get this NAD supplement because some jackass like Sinclair told me on social media because he researches it at a top institution, and I appeal to his authority that he can be trusted and not the foundational things that govern in the entirety of our health. Fuck those things. I'm just going to take this supplement. It just doesn't track.
Yeah, the basics aren't so basic mechanistically. They're pretty wide-reaching. So wrapping up here, exercise is big for my audience. I'm kind of coming from the CrossFit functional fitness space, so we are preaching to the choir a little bit. I definitely have the exercise bunch here. And I'm going to embarrass myself in terms of understanding it. In some of the research that I've looked at, I understand that some of the muscle signals, the myokines, might have some influence on tumor progression or something like that. Can you give us some insight into how exercise is so beneficial for cancer prevention, independent of the effects on obesity?
Yeah, and this might be somewhat controversial, but there are also some cases where exercise might be disadvantageous because of those myokines in very specific and probably rare types of cancers, like sarcoma. So if I have a tumor within a specific area of muscle tissue and I'm exercising, there is a potential scenario where those myokines could potentially stimulate basically signals that tell the cancer cells to grow. And then so you might hear of myokines or cytokines in general, like interleukin 6. Interleukin 6 has been implicated in terms of not only sarcomas, myosarcomas in terms of like muscle tissue or soft tissue muscle cancers, but also even in cancers that I've directly studied like ovarian clear cell carcinoma, a subtype of ovarian cancer, IL-6 is implicated in. So it's like we've spoken about already, it's this double-edged sword, but in general, the pros of exercise, even though we found components in the literature to say that something like exercise could be damaging, the pros of it still vastly outweigh the cons, despite mechanisms we might have discovered.
And I guess last question, you kind of already hinted at, probably supplements aren't going to be the way to go on stuff like this for prevention. What other suggestions, tips, besides following you on social media, would you have for people to try to suss out, hey, don't pay attention to this person and this type of information is better quality information?
Yeah. I mean, I'm not going to act like I don't take supplements. So if anyone wants to understand what I take, I'll just be honest about it.
Sure.
I consume whey protein isolate. I consume vitamin D because I know through blood testing that I'm relatively low on the vitamin D spectrum. I consume, so it's vitamin D and K2, and I consume vitamin B as well, and occasionally omega-3s, but I consume a lot of healthy oils in my diet through fish and a variety of other foods, even like flaxseed and stuff like that for fiber, but also omega-3s as well in my diet. But if somebody is making grandiose claims about these novel supplements like glutathione or something like that, as though there's some sort of remedy or magical cure to a disease state, implying that we're all toxic, there's a variety of red flags that should go up. So I think people should pay attention to the way that people say things, because you can generally tell a lot about a person's behavior and their morality by how they operate, independent of the information that they put out. And that's why I try so hard to be transparent about what I do and do not know with people, because at the end of the day, we all need to understand that there's limitations to what any singular person can know. And you could be the smartest person on earth, but if the smartest person on earth is acting like they know everything, they've suddenly just become the dumbest person on earth to me, because that means that their ego has taken over their intellectual ability to understand that they don't know everything. And that's a huge red flag for me.
Yeah, and I think just that confidence they have the cure-all is sort of the red flag of that belief about themselves.
Now, I'm all for having a discussion about these interesting things, but again, we have to temper what we do and do not know, or we have to make it very clear what we do and do not know about them in that conversation. And I think on podcasts like Joe Rogan, those discussions are important to have, but the message isn't clear enough to suggest that there's a lot that these speakers don't know. Like Joe Rogan doesn't know a lot of shit, and I'm all about asking questions and being curious, and I get a lot of interesting ideas from podcasts like them. I enjoy them, but I don't see enough I don't knows on platforms like that, or appropriate contexts. People need to pay attention for that stuff.
Yeah. Yeah, we've definitely spoken about that, the cure-all as well as the fear. And I do think, especially for people who don't have the understanding from an education point of view in terms of the science, that those are some of their best ways to start being able to discern better information. But also to follow you, remind me, I know it's your name, but there's a period in there somewhere on Instagram. What exactly is your handle?
So it's Dr.Joe Zundell.
Okay, well, we're going to put it in the show notes.
I do have a website if people are...
please.
Not that I boast about my qualifications often, but if people are curious about, podcasts I've been on and those sorts of things, or even my CV, I have my CV on a website. So it's drjoezundell.com as well, or drjoezundell.com.
Great. We will put that there in the show notes.
And see that info.
And I think you crossed like 1,000 citations or something. Did I see that right on?
Yeah, somewhat recently. So that was kind of nice. But I don't care how many. It's nice, but I don't really care how many other scientists cite my papers. It just suggests that maybe I'm doing good work. But honestly, the way that academia is currently, I don't really care who cites my work. I'll put it that way.
Yeah. Well, it does all suggest that you are in there doing the work as opposed to just putting out theories untested on social media.
I walk the walk. I try to. Where I cannot walk the walk, I tell people.
Cool. We will put those resources in the show notes. And thank you so much for your time today.
Yeah, thanks for having me. I really appreciate it.
Thank you so very much for tuning into the show this week. Thank you to Dr. Joey Zundell for his time and his wisdom. He mentioned it. I'll mention it one more time. If you want to find him on Instagram, Dr.Joe Zundell, Zundell. You will find him. Certainly follow along. I know EC appreciates his content and his perspective. Do make sure you're subscribed to The Consistency Project wherever you happen to be watching or listening to this so you don't miss another episode. Speaking of, EC and I will be back next week for a brand new episode of The Consistency Project podcast.